We all know how important it is to visit the dentist every year. We need to keep an eye on our dental health, of course, but could the health of our teeth and gums also play a role in the health of our entire body? Doreen Gensler is here with more on that. Hi, Doreen.
Hi there, Jim. Your mouth can actually be a window to the rest of your body when there's something going wrong with your health. Sometimes it shows up in your mouth first, and in some cases it's possible for your dentist to identify an illness that your doctor could miss.
I don't see anything that needs any treatment.
Well, I came to see Dr. Kravitz for a routine visit to get a night guard, and he noticed that I didn't have any enamel on the backs of my teeth.
That was a sign to DC dentist Dr. Joe Kravitz that his patient, Lita Allen, was either bulimic or suffering from acid reflux.
The outside layer of the tooth is gone or almost all gone. And it can happen very quickly, because the acids from the stomach are like battery acid.
After he asked Allen some questions, Dr. Kravitz determined that she was probably suffering from acid reflux. That was later confirmed by her internist.
And I was completely unaware of this. I knew that I had some discomfort with my stomach, but then I didn't know that it was so severe.
The mouth is not an independent structure. It's connected through your bloodstream, through your different organs such as your liver and your heart and your kidneys and your eyes. So if there's something that is healthy, it shows up in the mouth. And then if there's something that is unhealthy, it shows up in the mouth.
Kravitz says your dentist can actually identify several diseases and conditions by looking into the mouth. For example, when he sees a patient with discolored gums, they often have bruising or sores on their arms and legs as well, and he says that's a sign of type 2 diabetes.
Say there's no plaque, but the gums are purple and red. That's probably diabetes, because if you look at the skin, you'll find them on the skin as well.
High blood pressure is another condition that can often be identified in the gums,
where the gum tissues could look red and swollen, but they're not bleeding, because increased blood flow will make them swell.
And patients who come in with sweet-smelling breath rather than stinky halitosis, that can be a symptom of kidney disease.
And that's because the kidney cells are breaking down, so they're degrading, so they secrete this sweet smell out of the lung tissue.
Dr. Kravitz says all these symptoms are indicators of disease, but it's important to get checked out by your doctor. For Lita Allen, she says she may never have gotten diagnosed with acid reflux if her dentist hadn't seen the signs.
And I was very lucky that Dr. Kravitz noticed it, because my previous dentist didn't notice it, and I was shocked at that. I would have lost a great deal of my teeth.
Those were just a few of the diseases and conditions that Dr. Joe Kravitz talked to us about. He says he also finds patients who have red, swollen gums are often dealing with a lot of stress. And swollen, bleeding gums, along with bad breath and even impacted teeth, those can be symptoms of leukemia. But Wendy and Jim, your dentist isn't going to make a diagnosis. It's more like an early warning sign, and you'll need to see your doctor.
Good to know.
Fascinating story, though. Thanks,
Surprising.
Doreen. Yeah.